Dr. Isali Hussein, the Regional Coordinator for the Middle East and North Africa.
بسم الله الرحمن الرحيم. الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وصحبه أجمعين. His Excellency Dr. Mohammed bin Saif Al-Hosni, Under-Secretary, Minister of Health for Health, the auspices of the IGN Management Council meeting, His Excellency Professor Michael Zimmerman, Chair of Iodine Global Network, His Excellency Dr. Abdullah Saadi, WHO Representative in Oman, His Excellency Engineer Zain Al-Muzammil, FAO Representative in Oman, His Excellency Mr. Osama Makawi, UNICEF Representative in Oman. Dear colleagues and Regional Coordinator, it is an honor to open this Iodine Global Network Management Council meeting on behalf of the Iodine Global Network and its chair, Professor Michael Zimmerman. The Iodine Global Network brings together all key partners engaged in the efforts to achieve optimal iodine nutrition intake and support the salt reduction campaign. We are all pleased to have at this important inaugural session our partners from the World Health Organization, UNICEF, FAO, and UNFPA. On behalf of my colleagues, I would like to extend my most gracious appreciation to His Excellency Dr. Mohammed Saif Al-Hosni, the Under-Secretary of Ministry of Health, for the hospitality and support extended by the Ministry of Health to our distinguished guests who came from all over the world to Oman in recognition of the important role Oman is playing in support of the public health issues nationally and internationally. Iodine nutrition is not only important to assure adequate health, but more importantly for brain development, which is critical to enable each individual to reach his or her own potential. This public health problem can be addressed through the effective implementation of salt iodization as primary intervention to increase iodine intake and prevent deficiency. Iodine Global Network, which previously called ICC-IDD, while harmonizing the efforts to maintain adequate supply of iodine nutrition to the people worldwide. It is also in support of the policy of reducing salt consumption to prevent chronic disease and the policy in response to the political declaration of the United Nations High-Level Meeting on Non-Communicable Diseases. We have today with us the regional and deputy regional representative from America, Africa, Western Central Europe, Asia, South Asia, China, Far East, North Africa, and EMRO to deliberate on the current global progress against IDD, salt reduction and iodization, and discuss the achievements and disappointments, and highlights of iodine thyroid program research and planning for 2020. Many thanks to our colleague Dr. Samia Al-Vannami, Director of Nutrition, and the team. Thank you very much indeed. For nutrition, on the team from the Nutrition Department and the Public Relations Officers in the Ministry of Health for all support extended to make this meeting a success. Last and not least, a big thanks to Mrs. Gosia Gizak for the support during the course of getting ready for this meeting. Once again, I welcome my colleagues to Muscat. I am sure that you will be fully dedicated to the sessions of this important council meeting that will follow. But I do hope you will enjoy fascinating Muscat with its beautiful beaches, desert, mountains, friendly people, and various Omani cuisine. Thank you. Now, let me introduce my colleague, Dr. Samia Bandami, Director of Nutrition, to present the IDD National Survey in Oman. Thank you.
Thank you very much, Dr. Azadin. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Allahumma salli wa sallam ala khayri man salla wa sallam. Sayyidina wa nabiyyina Muhammad sallallahu alayhi wa sallam. Your Excellency, Dr. Muhammad Al-Hosni, Undersecretary of Health Affairs, Ministry of Health and of Oman. Your Excellency, Professor Zimmerman, Chair of IGN. Your Excellency, representatives of WHO, FAO, and UNICEF, distinguished professors, regional coordinators of IGN, colleagues, ladies and gentlemen. We are delighted today to have you here in our lovely country, Oman, to participate and share in the annual Iodine Global Network 2015. Thank you for all of you coming and travel long distance that remind all of us just how important the iodine, nutrition and salt reduction is for public health. The Ministry of Health in Oman have given great concern to both salt reduction and salt iodization programs as one of emerging public health issue and for combating the epidemic of non-communicable disease. And reference to the Ministry of Health 2050 vision and for the country 2040 vision, we have our also policies and strategies to combine and to work to maintain the iodization of salt and also the strategy to reduce salt in some sources of food. By doing so, we have also planned well for integration of both these strategies, and in doing this, we conducted a national iodine survey last year, and I have the honor to present the results today for all of you. So as background, as all of you experts here, and you know that iodine deficiency disorder is the most single cause of preventable mental retardation and brain damage in the world, and also it delays the cognitive and development of children, and also affects the pregnant woman and cause a lot of stillbirth and abortions. To give you background about my country and the work in iodine, Oman is the first country in the region which started the implementation of iodine salt fortification, which was in 1993-1994. And the result that time that only 22% of households used iodized salt, and 50% of school children had urinary iodine below the recommended level. And after that, after 1993, after that survey which conducted in school children, many national surveys and studies follow up. And as you see, after I will show you the local legislation which was issued in 1994. So after the legislation, as you see, there is availability of iodized salt as per these graphs, which show there is salt coverage in Oman increased in each survey. And the last survey before the 2014 survey, it was in 2004, and it showed the coverage was 65.8%. Here the policy and legislations, we are follow the GCC standards, and we have also the local standards. From this slide you can notice that at GCC standards, each country has different requirements, and even the fortificant is different from one country to country. And this was in 2007, the last one which is published online. But I will show you in Oman we have revised legislation in 2010. So in Sultanate we are using potassium iodate and potassium iodide, which has these levels, the minimum and maximum level. And then we revised this in 2010 and we changed this level. So this is the legislation which issued by Ministry of Commerce. And this is in Arabic, but it showed that we started in 1995, and then also not only fortification of salt, but also we started in 1997 fortification of flour with the iron and folic acid. And in 2010 we included also cooking oil, we fortified with vitamin A and vitamin D. And here this the amount in 2010 that we fortified with iodate potassium and iodide potassium, the same level from 34 to 64 milligram per kg. And this legislation is mandatory for all table salt, not for artificial use of salt. So it's all mandatory, all imported salt or locally produced salt to be iodized. And we have 2 local companies which produce salt here in Sultanate. The National Iodized Salt Committee here in Sultanate composed of multi-sectoral. We have a Ministry of Health, Nutrition Department, also Directorate General of Specifications, Ministry of Commerce and Industry, and we have very cooperation with them. They issue the standards and specification, and there's also the municipality for inspections, and also the salt producers, importers and retakers. We have meetings with them on regular basis, and of course the organization, WHO, UNICEF, and your organization for technical support. Then for the current iodine survey, which will show the result, we conducted in 2014. The aims were to measure urinary iodine concentration in school children. The age was 6 to 12 years old, boys and girls, and also to assess the iodization level in salt at both household and its compliance with national regulations, and conduct national salt situation analysis. Also using this data to establish a very strong nutrition surveillance system as one of challenging and to sustain this program, the success of this program. Also to assess the knowledge, attitude and behavior of population regarding consumption of iodized salt. So this is the sample of the study. We have the total sample is 2,560. And we took from all schools in the Sultanate. We have 11 regions in Sultanate, so we took from all 11 regions, and we calculated based on regional population. So this is the result at national level. The median urinary iodine is 195, and for boys 199, girls, and there's no actually significant difference between boys and girls. And here for the categorization as per WHO, UNICEF and IGN, that the categorization of the range of urinary iodine. So most of our children are in the normal range, which is 100 to 300. We have some above 300 and very little below the recommended levels. And then this is maybe for discussion and for your recommendations. We have some regions which have over intake of iodine. And here the regions, as you see here, 11 regions, and as you see, one region called the Wusta and the other Dhufar, which has maybe a little above, I don't know, maybe normal, maybe over intake. This is we need to discuss it and to help us how is it pocket, we have to target them, or is it normal, or we have to reduce the level of iodine and salt. So this is the regional variations. And this is, as you said, the status of 10 program indicators. We assess it with the consultant and with Dr. Azizdin, and we find that most of the items we are with it, like for example, presence of national multi-sectoral. We have it, very strong demonstration, of course, of political commitment. The Minister and the Undersecretary are very supportive for such programs. And we have legislation, and we are very close contact to revise it or to change it with Ministry of Commerce. Assessment of progress in the animation, maybe establishment of methods. This is partial because reporting incomplete sometimes and irregular. So maybe we have to work on this area. Access to lab, we have access to lab, either Ministry of Health, Ministry of Commerce, and also municipality. We have different labs in the country. And establish of awareness, we have to work on this element because we need for more focus on social programs to show the importance of iodine and also to show the other sources in diet for iodine intake. Routine availability of data, at least quarterly and or at least every 5 years surveys. Maybe this also we need to improve it because last survey in 10 years, but we think we are doing well and we don't, as you saw from the result, we don't have public health problem in iodine deficiency. Routine availability of population-based data, urinary iodine every 5 years. This is partial, completed. Ongoing cooperation from salt industry. We have meetings, but some are not cooperative, so it's partial fill. And presence of national database for recording of results. This is, yes, we have it. And we have, of course, challenges and threats for this program, as you see. Maybe low awareness. We need to work on this area for campaign and improve the awareness of public on importance of if there is deficiency in iodine intake and to teach them how to take iodine from other sources. We need to work on how to establish routine monitoring system for iodine and also different, as you saw from the GCC standards, it's different requirements for each country and we are very close, we are like one country, so sometimes it's easy access for other type of salts with different levels of iodine and low awareness of alternative ways and access, as I mentioned before. And we need to establish surveillance system for iodine program. So for conclusion, Oman has all right elements in place to make this program success. Only we require to work on some area and especially the monitoring and quality control, where better closer working relationship with private sector is required. Areas of education also we have to increase more the awareness of public. Monitoring, we need to enforce the monitoring. And even the goals are achieved and we are free. I can say it from my view that Oman is free of IDD, but still we have to sustain these results and we work always for it. Thank you very much.
Now to give you an introduction of the recent global progress against IDD, please welcome Professor Michael Zimmerman, Chair of IGN Global Network.
Okay, good morning everyone. Assalamu alaikum. It's a real pleasure and honor for Iodine Global Network to be holding its 2015 Management Council meeting here in Oman. I would like to thank the Sultanate of Oman, the Ministry of Health of Oman, and particularly His Excellency, the Undersecretary, Dr. El-Hosni, also Dr. Samia and her team from Nutrition, and it's wonderful to see the representatives of WHO, FAO, and UNICEF here as well this morning. It's a real pleasure to be here in Oman. Oman, at least in Europe and Switzerland where I come from, has a long reputation as being the friendliest and most beautiful country in the Gulf region. So it's a real pleasure to be here. I'm going to talk about global iodine status and emerging issues in 2015. Following on a little bit from Dr. Samia's presentation to give you a little bit of a global perspective. Now, as Dr. Izzaldine mentioned, we used to be ICC-IDD, the International Council for the Control of Iodine Deficiency Disorders. We've shortened our name to the Iodine Global Network, and we've also grown and expanded. And now we are truly a global partnership, a technical advisory group that actually has been advising WHO on iodine nutrition for over 25 years now. You can see that we published the IDD newsletter, which I hope all of you received, which gives you an update on global progress against IDD around the world. And this global partnership is now in place at both the global, the regional, and in many countries the national level. We have a global partnership which includes the major agencies, UNICEF, GAIN, the Micronutrient Initiative, WHO, the CDC from the United States, and many other important partners around the world. At the regional level, we have 10 to 12 regional and deputy regional coordinators who are all here this morning. And then in over 100 countries around the world, we have national coordinators who are actually the machine room of our organization, who actually are the ones who are carefully monitoring, nurturing, and supporting local coalitions to control iodine deficiency in their countries. So I'm going to quickly show you a series of maps which just shows you how remarkable the progress has been against iodine deficiency around the world over the last 2 decades or so. This has been described by Jim Grant from UNICEF as a major public health triumph. And when we do eliminate iodine deficiency from the world, this will be an achievement at the level of the eradication of smallpox. So here is the global map in 1993. And this was based on goiter rates in school children around the world. All the countries that are purple in color had some degree of iodine deficiency in 1993 based on an elevated goiter rate in school children. You can see most of Latin America was affected, most of Africa, and most of Europe and Asia and Southeast Asia. 110 countries were iodine deficient in 1993 at the national level. In 2003, you can see the remarkable progress over the course of 93 to 2003 in correcting iodine deficiency in many countries. This is due to the spread of iodized salt programs around the world. You can see that by 2003, most of Latin America was now considered to be iodine sufficient, much of sub-Saharan Africa, and much of East Asia and South Asia. So in 2003, 54 countries remained iodine deficient. In 2007, 4 years later, 47 countries remained deficient. You can see that there was further progress, particularly in Africa, Europe, and in South Asia. In 2013, you can see the purple gradually disappearing from the global map, which shows you that iodine deficiency is being controlled at the national level in many countries. And finally, here we are in 2015, where we have only about 25 countries that remain iodine deficient at the national level. And I must say that out of those 25 countries, 12 or 13 of them are small island countries for which we don't have real good data yet. But you can see there are still large countries that remain iodine deficient at the national level. You can see Russia, for example, the Ukraine, Morocco, Ethiopia, Angola, Mozambique. So we do still have a way to go in many countries around the world. You can see that there are some countries that are marked in red on this map, and these are countries that actually have, at the national level, a median UIC which is greater than 300 micrograms per liter, which is considered excessive iodine intake. So we have to be careful when we introduce iodized salt programs into countries that we correct iodine deficiency, but we don't give too much iodine. And for example, Brazil right now is rapidly moving to reduce iodine intakes in their country. So 25 countries remained iodine deficient in 2015. Now you can see here, this is another way of looking at what we just saw on the global maps. Look at the number of countries iodine deficient. You can see this has fallen dramatically since 1990, when 110 countries are deficient, and currently in 2014, 25 are deficient. Now this has been a successful program because we have a very effective, inexpensive intervention to correct iodine deficiency, which works extremely well in most countries around the world, and that is universal salt iodization. Salt is a great carrier for iodine. We only put parts per million into iodine. There's no technical issues. There are no sensory issues. And it's been extremely successful around the world. This map shows you that this is data from UNICEF, the State of the World's Children report in 2014. And you can see that the countries still in light or dark blue still have a ways to go in terms of increasing household coverage of iodized salt, but many countries have achieved greater than 50% household coverage with iodized salt, and some, particularly you can see in Latin America and China, have achieved over 90% household coverage with iodized salt. So this is why we've been so successful in reducing iodine deficiency around the world. Now, of course, in the current day and age where we have a strong push towards salt reduction in an effort to reduce hypertension and cardiovascular disease in populations, this salt iodization effort is going forward in the context and in close partnership with salt reduction efforts. But I'd like to remind you that every day we estimate that nearly 100,000 babies are 15. And I put a red box around the Eastern Mediterranean region, which includes Oman and most of the countries in the Gulf, and you can see that insufficient iodine intake affects about 35% of 6 to 12-year-old children in this region and 34% of the general population. So Oman is one of the leading countries in this region because of the very successful and effective salt iodization program, as Dr. Samia has just shown. I think that the data show that Oman has an ideal program in terms of salt iodization and should be a leader in terms of showing the rest of the countries in this Eastern Mediterranean region just how effective salt iodization can be. This is the global map of the Iodine Global Network Middle East and North Africa region in 2015, and you can see that mostly countries have adequate intakes with the exception of Morocco, Algeria, and Sudan. So with that, I'd like to close and thank you very much for your attention, and I'm really looking forward to the meeting over the next 3 days, and I would like to again extend my appreciation and gratitude to the Ministry of Health of Oman for being such a gracious host for us in the next few days.
Now to give you an overview of the IED situation in the Middle East and North Africa, please welcome Dr. Jonathan Goldstein, the Executive Director of the IGN.
Just ask what my presentation is. Okay, good morning, everyone. And again, it's a distinct privilege to be here. Thank you so much for hosting us and allowing us to come to Oman and be able to not only bask in the success of your program, but also have the opportunity to really reflect on where we're at globally and in the region. I prepared a short presentation on the current status of IDD and salt iodization programs in the region, but I think a lot of that has already been summarized by Dr. Samia and by Michael. I also have as part of this presentation a summary of a recent regional workshop that took place in Dubai, in which we brought together 14 countries in the region to discuss current strategies and to really to reflect on whether or not we're making the most amount of progress as we can in achieving optimal iodine nutrition. But I think that I'll reserve a number of those comments until later in the morning when we talk specifically about the regional workshops and just speak a little bit about what we know about the current situation in the region, and then reserve time for you to provide some welcoming remarks as well. So this is a very small table, but it is extracted from the global scorecard that the Iodine Global Network maintains on its website. And sorry. And the global scorecard is a very, very important tool for us to be able to track what the current situation is in every country throughout the world. As Michael summarized, we do have reasonably updated estimates both on the coverage of adequately iodized salt in countries as well as on what the current iodine status is of populations. As you can see here, even in the global scorecard, the current estimate of household iodine salt from several countries is somewhat outdated, but we're in the process of updating these as soon as data do become available, and we're able to get updated estimates. What's important about the situation in the Middle East and North Africa is that whilst there has been tremendous progress, there still is a large number of the population that remains unprotected from iodine deficiency, and for which we really have to redouble efforts to make sure that there's adequate iodized salt that is reaching all segments of the population. One of the problems in presenting national aggregate data is that we hide disparities in some of the inequities that occur. I thought that your presentation, Dr. Sami, was important because not only did it highlight that there were some regions with potentially high levels of urinary iodine, but similarly there were some regions with low urinary iodine, hence the importance of having really robust surveillance systems. The other major comment that I want to make in this context is that as we push ahead with a deeper appreciation for the complementarity between salt iodization and salt reduction, having really robust surveillance systems becomes imperative. As salt is the vehicle for delivery of iodine and the salt intake declines, we can make adjustments in the iodine content in the salt, but we need to be able to have good, strong evidence and data to be able to inform those policy changes. So when you talk again about interpreting the 2014 survey data, we have to not only think about what is the coverage of iodized salt in the population and the urinary iodine levels, but increasingly, what is the total salt intake, so that we can put those pieces together and formulate appropriate program adjustments. This is something that we'll really be focusing on as a management council over the next few days, because this is really the emerging landscape that we're confronted with programmatically. This is a graph, actually, I'm stealing these from Isoline, that had been presented in our recent regional workshop. And what this shows is that whilst there has been good coverage overall across the region in the proportion of households using adequately iodized salt, we've reached somewhat of a plateau, if not a slight decline. And that there are a number of different factors and reasons for this. Another major reason for us to come together is to really discuss what are some of the key challenges that we need to confront and understand. I'll just go through these very briefly, again, to highlight not only the fact that we've made remarkable progress and there's been a lot of achievements, but that we have to be honest about where there have been constraints and there are areas that do stand for improvement. One of the biggest problems and challenges that we're facing within the iodine community is competing public health priorities and challenges. As an infectious disease specialist, you certainly understand that we have limited resources to allocate towards health programming and budgets, and to be able to maintain a strong advocacy for the importance of iodine is probably as important now as ever before. In several countries, we don't think in Oman, but in other countries in North Africa, there's a very limited government commitment to salt iodization and to iodine deficiency. And this is an area where, as the Iodine Global Network, we would really like to try to ensure that governments do understand the importance of iodine and do prioritize it as part of their overall health and development budgets. The third and probably the final point that I want to make right now is just the importance of regulatory monitoring and quality control and quality assurance. What we know is that salt iodization is a compelling intervention. We know that it can be very successful, but we need to make sure that there's good uniformity in the amount of iodine that is put into salt at the point of production. And having systems to be able to monitor that amongst factories, amongst importers, is quite critical. What we're beginning to see is a great deal of variability in the iodine levels in salt, and if we can control that more effectively through robust regulatory monitoring systems, this would make a big difference. And where regulatory monitoring systems are really determined is through government commitment. So this is an area that we're continuing to put a lot of emphasis into. The final point, Dr. Sami, actually you mentioned this, is that in a region like the Gulf, where you have a number of states that are more like one state, where you have different standards and you have a great deal of flow between countries, is the importance of having some regional harmonization. One of the things the Iodine Global Network does bring to the discussion is an ability to work across countries, and where there may be scope to ensure greater uniformity and harmonization of standards, that would greatly facilitate monitoring efforts and regulatory efforts to be able to make sure that salt that is flowing between countries is not only meeting an individual country standard, but the standards that are shared across all countries in the region. So with that, I will go ahead and just conclude my comments right now. Islene, I'll ask you to comment and introduce.
Well, thank you very much indeed. You know, His Excellency, I think he has another commitment to go. So therefore, we will try, you know, to minimize, you know, the talk or make it shorter. You know? I will just take 3 minutes, you know, to just 3 minutes to brief you on salt reduction and ID fortification, which, you know, one of the, as mentioned by Professor Michael and Jennifer, you know, this is one of the important issues now. We know we have to combine both salt reduction and salt iodization. So why salt iodization? I think it's very clear that we don't need to talk. You know, we started, you know, all these, you know, iodine deficiency as one of the most important nutritional deficiencies in the world. Result was impaired cognitive development and function. But you saw hypothyroidism, congenital anomalies, but now this is disappearing, you know, gratefully, you know, because, you know, of this. But, you know, in Europe and this, they don't use these things. You know, I use it here because still we have this problem in some countries. And this is more, Your Excellency, is more effective than saying this brain damage or something. Our people, they believe on this one much better, I think so. Well, you know, why salt reduction also, you know, is again to the brain. You know, when we say the brain development there, iodine, you know, enhances, you know, the IQ. Here, you know, also it damages, you know, the hypertension, you know, when it's taking salt, and it also affects, you know, the brain. Well, to the role which we have to play, this will be on national level. We take situation analysis and also coordinate the monitoring of salt intake, iodine intake, and salt reduction. The support will be ongoing national plans to strengthen role of food manufacturer. Of course, those are the most important, you know, to play with. And in the synergetic implementation of the post-population-based sodium reduction strategies and that salt iodization program. So what the role IDD will be, ICC IDD, IGN will be doing is to combine or to integrate, you know, both salt reduction and the program together, and then develop, you know, a salt iodization and salt reduction strategy at national level, including, you know, the measurement, monitoring, and evaluation. Now, from now on, I think in this region, you know, what we do when we collect, you know, samples, urine samples for measurement of iodine, urinary iodine concentration, we're also going to measure, you know, the sodium intake here together. So we combine both program. We were going to establish, as Dr. Samia and colleagues said, you know, that, you know, a good surveillance system to control and reformulation, improve nutrition labeling, and consumer awareness. Well, where this we can do together, this is the area we can combine, you know, the policy level, monitoring, surveillance, communication, advocacy, and most importantly, research. Well, that's it, you know, I have to finish. We have to be very careful, you know, the salt we intake in the restaurants is too much. And then you can see here, you know, actually, they give salt and little soup on it. So we need to work on this. Thank you very much indeed. You excuse me, I did so fast on this one, and because I said, you know, His Excellency, we are so grateful to you, you know, to have made our day today. May I call you and Your Excellency, Dr. Abdullah, Professor Michael, Dr. Zain, and Jensen to come on the stage here. We need to present few things, you know, for His Excellency, for and a small gift for you for this.
So each one represents something.
In fact, Your Excellency, you know, there was so many. The IGN was selected so many countries, but you know, Professor Michael Zimmerman, as you said, you know, they said Oman. Oman, we don't want to talk, you know, too much on this one, but you know, the concern we have on public health here, and as you said, you know, Oman started actually the implementation of salt iodization of the first country in the region. So we have the pleasure, you know, to Michael to present, you know, a small token for Your Excellency as a memory for having us in Oman for this meeting. Thank you. At the same time, I think, you know, Dr. Samia, you know, this is a small gift from the Minister of Health to IGN, Michael, you are there. Yeah. The support we are receiving actually from our colleagues in United Nations offices here, WHO, UNICEF, FAO, and UNFP is immense actually. WHO has supported, you know, this survey for iodine deficiency survey, also UNICEF. So we have small token for the WHO, Dr. Abdullah, you know, for. Well, actually, you know, to describe Dr. Sabri, she made a big revolution in nutrition, Your Excellency. You know, so I have the pleasure actually working with them. You know, the way they are doing actually brings, you know, real change in the way we take nutrition. We are grateful to have UNICEF, we have FAO here, and FAO also are trying, you know, to change, you know, the intake of food, you know, nutrition, food-based nutrition strategy, and to go back to nutrition, natural nutrition. We thank you very much indeed. Dr. Samia, this is not token for you and for your team for doing this. Thank you very much indeed. For colleagues and for UNICEF, that time you have your certificates actually, because His Excellency need to leave, we put your certificates inside, and for colleagues, you know, you have it there. And colleagues, thank you very much indeed, you know, the public relations officers, all of you in the nutrition department, you know, it was so wonderful, you know, what you have done. Shukran jazeelan. يعطيكم العافية. Can we take a group photo before this? Can we take a group photo?
Hi, John.